Welcome to The Kick, your expert-led podcast helping you explore and learn everything about getting pregnant, pregnancy, birth and becoming a parent.
On the podcast and our online pregnancy program, Grow My Baby, we share my experience of helping more than 4,000 babies to be born.
And our experience of running a women's health clinic and parenting 4 boys.
We're here to help everyone to feel empowered in pregnancy and birth with real-life practical information.
Hello everyone, I'm Brigid Maloney and today we've got a little quick kick. Now for those who are new to the quick kicks, these are just little snippets of podcasts that we pull out of previous episodes that are really important to highlight. So this one comes from us sort of scrolling through Instagram or when we're listening to people talk about their birth, and we often hear, "I wish someone had told me," when it comes to the shock of having an instrumental birth. So our goal is that we help prepare you for every possibility during pregnancy and birth, and it underpins everything we do. And it's working. We get listener responses all the time, but we got such a beauty the other day, I really want to read it out. So, hi Dr. Pat and Brigid. I wanted to send a message to say thank you so much for your podcast. I've just had my first baby in the public system. I found your podcast and listened to basically every episode more than once. I would have been completely clueless and lost without everything I learnt and wouldn't have known what questions to ask at my midwife appointments otherwise. Everything was straightforward and low risk until 37 weeks when I started getting high blood pressure readings. The midwife wasn't concerned as my blood pressure was within range, but because it was a sudden increase from what I knew was normal for me, I started having my blood pressure checked regularly. I ended up being diagnosed with gestational hypertension about a week later and induced at 38 weeks in 4. The induction ended up in what you call the lights and sirens emergency C-section, but I felt surprisingly calm because I understood everything that was happening and felt like I knew what to expect. I have a severe medical phobia and I'm prone to fainting even when getting any type of needles, so couldn't believe I was able to make it through the C-section without needing to be put under general anaesthetic. I had already had an epidural in, but had thought I might not cope anxiety-wise in theatre. I definitely think I would have needed to be put to sleep if I hadn't learnt what I had from your podcast, so I wanted to say a huge thank you to you both as I was able to meet my baby straight away. I will sign up for the Grow My Baby program for my next pregnancy and I recommend you to all my friends. So, if you've hit play today on this ep, well done. And if you've got a friend who often falls into that camp of, why didn't anyone tell me? Send her this so she can have a birth where she might just find that she is also surprisingly calm, just like our listener who graciously sent us her story. Thank you for that feedback. It was just so fabulous to read it. And today's quick kick talks about a birth scenario that lots of us want to avoid, but it's common. We want to remind people of the different types of instrumental births and why they are used during a birth. Have a listen to Pat describe the 2 options, vacuum and forceps. Why don't we talk about vacuum first?
Okay, so vacuum, there's definitely a time and a place for vacuums.
They're called Kiwi cups or something too.
Yeah, the one we use is called a Kiwi cup. That's just it's a brand name. It's a nice.
Or ventouse.
Yeah, so ventouse I think was the original one that was described, and they're all a version of a suction cup with a suction generator. And the early ones you actually attached it to a pump to generate the suction.
With someone pumping it with their foot or something?
A little motorised pump,
Oh,
yeah. And the modern ones like the Kiwi that we use, there's a little hand pump attached to the handle that you pull.
Oh, so you're in charge of how much vacuum you...
You create, exactly. Yeah,
wow.
And it's got a little gauge on it to tell you that you're not pulling up too much suction.
Yeah.
So think of this as like a little suction cup. It's about 5 or 6 centimetres across, and it goes in through the vagina onto the baby's head. And the trick to it is to put it in the correct position
to begin with.
Yeah. So there's a sweet spot on the baby's head that if you apply some traction at that point, it'll steer the baby in the right direction down the vagina.
So if the baby's sort of got a malposition like you talked about just then, how do you get to that sweet spot?
With a lot of experience. And that's the problem.
Yeah.
So using a vacuum to correct a malposition is complicated.
Yeah.
And tricky. And needs some experience.
And is it only an obstetrician that does assisted births?
Give or take, in Australia certainly that's the setting. Now this might be a GP obstetrician or a specialist obstetrician, but it certainly tends to be a job for doctor. There are some isolated areas where midwives do instrumental births, but that's not common. And the vacuum has a time and a place. But part of the safe use of the vacuum is a safe assessment of exactly where the woman's up to. So if you've worked out that someone would benefit from a instrumental birth, there's a whole checklist of things you have to get right. Firstly, you've got to explain it to the patient, and that's why I think knowing something in advance is a good idea.
Yeah,
because it's not often the most convenient time.
No, I could imagine you'd be rapid fire. Well, this is going to happen, and this and this and this. Yeah,
and people will commonly report, yes, they sort of consented me.
Yeah.
But I didn't know what the hell it was all about.
So you definitely have to be consented for a vacuum.
Yes. I think that it should have a proper consent form like an operation.
Yeah.
Not everybody feels that way. But I've got a long-standing view that these obstetric emergencies, in quotes, are not that rare, and therefore we should be probably educating our patients in advance as part of the informed consent process.
Oh, like even before they go into labour.
Yeah, so I can like listening to this podcast, and so I can say, I felt that Mrs. Smith had a very good understanding of how it all worked because she'd read her stuff, and that if we've established that the patient needs or will benefit from a instrumental birth and she's agreed to have one, then part of that is discussing the risks and benefits. So the benefit of a ventouse or vacuum delivery in this setting might be that we're worried about the baby's condition and we'd rather have the baby out in 5 minutes than 2 hours. I've called the paediatrician, we're all good to go, but we want to get the baby out quicker than you might be able to achieve on your own. Then we need to know the risks, and the risks are of the vacuum either might not work, all right, so it might just keep coming off. And
so it just pops off.
So then we might need to do forceps, or we might need to do a cesarean section.
Yeah.
And then there are some other risks involved in the vacuum in that it can put excess pressure on the head.
Yeah, it can cause a bruise or something, can't it?
It'll always cause a bit of a bruise.
Yeah.
That's how it works. It sucks some of the baby's scalp up inside it, and that's how you get your grip. But occasionally that can cause bleeding under the skin.
Yeah.
From a little bit, which is pretty harmless.
What's that called? There's
a thing called a chignon, which is the lump that it causes on the baby's head, right up to something called a subgaleal hemorrhage, which is a significant dangerous outcome where there's bleeding between the baby's brain and the skull.
And how common is that?
Well, it's very rare.
Yeah.
But it's serious.
Yeah.
And it's a potential complication. So we like people who are doing instrumental deliveries to be experienced.
Yeah.
To be well educated and know what the right time for that type of instrumental birth is, and we also like them to be expertly carried out.
And how many times? I know I've heard you say too that there's only a couple of times that you can try the vacuum.
Yes, so different people have got slightly different rules about that, and different hospitals maybe. But certainly, if it keeps coming off, then it may be that's the situation trying to tell you that it's the wrong thing. Yeah. So they will disengage, and sometimes that's the situation saying you better think of a new plan.
Yeah.
Yeah.
And is that your first go-to?
Sometimes. So there are a whole lot of other things I'd take into consideration. Yep. But often if I think that it's going to be a relatively straightforward situation, I will prefer a vacuum over a forceps because in experienced hands it will usually work, it's give or take much kinder to the mum.
Oh,
okay.
What do you mean by that?
Well, Forceps will almost always cause a degree of vaginal tearing.
Yeah.
So much so that we'll often do an elective episiotomy, make a cut, because the forceps go around the outside of the head and increase the diameter of what's going to come out through the vagina. Whereas the vacuum just sits on top of the head and doesn't make the head any wider.
Yeah.
So there's definitely a lower risk of significant tearing in the vagina from vacuum versus forceps.
Yeah.
So if I'm really confident that I'll be able to get the baby out with a vacuum, then that's usually where I would start.
Yeah, rightio. Okay, so you haven't been successful with the vacuum and you've moved on to the forceps, or you've chosen forceps straight up. So just describe the forceps. I just, in our antenatal classes, people just laughed and called them the salad tongs.
Yeah.
But they kind of do look like salad tongs.
Yeah, they do. They do a bit. So they look like a pair of
old-fashioned attached, salad tongs.
Yeah. So they're not attached. They come apart into two pieces.
Yeah.
And that was actually how they were invented. Everyone thought in the very early days that we should be able to invent some obstetric forceps, but nobody knew how to do it.
Yeah.
And the instruments that they kept making were articulated like a pair of scissors are.
Yeah.
With a hinge, and of course you can't get them on. So the first successfully invented pair are like the ones we use today,
right,
that go on in two pieces, and then you stick them together. So you slide one on, then the other one on, and then connect them.
Yeah.
And the forceps come right around the side of the baby's head, and up under the upper jaw, and that's and they get a very good grip on the head by doing that.
Yeah.
And you can exert quite a deal of force by pulling on those.
So I guess you want to know more about why and when an instrumental birth is recommended. I want you to know all the risks and benefits, so head to one of our very early episodes, episode 30, and you'll learn all the information that you need to be to help you feel more in control when what is commonly described as the cascade of interventions. Thanks for listening today. Head to episode 30, share this with a friend who could also use this knowledge. If you want to know more about our expert-led pregnancy and birth course, Grow My Baby, head to our website, growmybaby.com.au, or hit the link in the show notes. Until next week, have a fabulous week. Bye for now. Hey, even though Dr. Pat is, a doctor, and we get lots of other doctors and other experts on our podcast, I just need to remind you that this podcast is for informational purposes only. We share lots of medical insights and experience, but everything we talk about is general in nature and may not apply to your specific situation. Please always consult with your own healthcare provider for your individual medical advice when you grow your baby.